I think we can start. And as we said before, if more people is joining, then we will just introduce them at the time they are getting into the meeting. Just as we said, this is the first webinar for the Quality and Safety Working Group. The idea is that we can have these meetings through teleconference like as we used to do, but at the same time this tool lets us record our meetings, so people that are not able to join or people that want that are not in the working group but want to take a look at the work that is taking place in the group can just join later and watch it in the TransplantChild website.
That's good, because I think that one of the problems that we have had all the time is to get people to join the meetings and to work. So it's very good if we can send them a note that they should go in and look at these meetings that were recorded. So that's
right. So now we are recording the meeting. So anything we are just talking will be recorded, and as we were pointing out before, we will start the meeting. As we just can introduce ourselves for anybody who will watch this webinar. I am the coordinator representative of the working group at the Hospital La Paz in Madrid, and you can introduce yourself, Dr. Weber. I think it's easier.
And I'm a transplant surgeon in Stockholm, and I'm the technical director of this working group.
Perfect. So they already know, they have this slide, so they can have our details here, and we will go through the meeting then. I have just prepared a first slide so we can get an introduction of what has happened in the network for these first and a half years of the network. As we talked before in other working group meetings, we plan to have a survey for all the members in the network, so we could collect quality and safety standards, indicators and outcomes, and also institutional objectives. We didn't do it in the first year of the network, so we are just preparing that survey in this second year. At the same time, as the slide points out, the European Commission is also launching and preparing a system common to all the European reference networks that will allow to collect and assess the activities of the network. So at the same time, this survey will provide TransplantChild extra information that we should be able to get into this system that the European Commission will launch in the next November meeting. And finally, we are in 2018, and members of the network applied in the joining of the network in 2016. So we think it's a good opportunity to collect and update that information, that data that all the hospitals provided at the beginning. That's the introduction. As we have, according to these statements, we have produced a pilot version of this quality and safety survey.
Yes.
It will be available first for the quality and safety working group members, but we intend, there's not a date settled down yet, but we intend, as you know, to launch it to everybody, preferably before that meeting that will take in Brussels next November 21st and 22nd, where all the European reference networks will gather in Brussels, but afterwards we will also celebrate aboard of our network. So that's the general.
Can I ask something?
Of course.
Can I ask?
Of course.
Because if we want to launch it before the meeting in Brussels in November 21st,
that's right.
I mean, we don't have that much time, so we need to get it. We need to have it approved by the testers before that, I guess. So.
Yes, the idea is that we will just send this webinar, of course, and another mail to all of our colleagues participating in the working group. I think that we need more. We have talked about that before. No, we need more input, not only from both our hospitals. So that's the idea, that we can test it, and if we test it, I don't know, maybe in 3 or 4 hospitals, then we will be able to launch it. If we do it before the Brussels meetings, that will be great. If we cannot do it, then we will have to do it afterwards. So that's the idea.
And I think that we need to set, if we send it out for testing, we need to set a strict deadline so that we have some pressure on the participants. Yes. Perfect.
Perfect. Yeah, I agree. I mean, I didn't prepare a date, but we can think about it in this meeting or afterwards. Perfect.
Yeah.
Well, as I said, the meeting is available internet. It's a self-assessment survey, so anybody who is member of the network will have the link to the survey and will be able to input their data from their own healthcare provider. We know that it is a long survey, that it has a lot of items that can be collected, but one of the issues we will discuss in this meeting is that we think that if we detect the people in our hospitals that can have this information beforehand, and we somehow manage to connect not only ourselves but also the responsibles of the different transplantation programs and the different services involved in transplantation, then we will be able to do it properly. I mean, it's a long survey, it's a very ambitious survey, but if we do it with this preparation, then I think we will be successful.
I hope so.
Perfect. If you haven't had the chance to access to the link yet,
yes, I have looked at it.
Yes, as you already know, we have put like 2 blocks, no, in the survey, no. One of them is this first one that focus on the organizational level. We don't want to talk only about transplantation or pediatric transplantation, that is the focus of our network, but we want to collect, as I said, we did it when we applied for the network, we want to collect an update of what issues, what organizational aspects are relevant for a hospital to be involved in a network like ours and all networks. So as you can see in the slide, we have questions around which healthcare services are provided by the different hospitals, if there are quality and safety assurance or management systems inactive in every hospital. We also go through research facilities, resources, policy and procedures, also about e-health and e-medicine, patient-centered care and patient empowerment, patient safety. We know that many hospitals around Europe have safety deviation reporting programs that, of course, it will impact in the pediatric transplantation, but in all the processes taking place in the hospital. And just to say all the list, also about informed consent policy in the hospital, the conflict of interest in every hospital, if there are rules about it.
Can I ask one thing about the informed consent policy? Is that for the network patient management system, or is it for sort of consent in a more general way?
This is, I think it's intended in a more general way.
Okay.
So, of course, when we, for example, asked for research facilities, we will have the chance in the next block of the surveys to focus on research, for example, activities. So I think that this blog is intended to have a broad overview of every healthcare provider. That's probably important. We will go through it afterwards. Probably we can feel, I mean, every representative of every healthcare provider participating in the network can have an idea of these issues.
I think so. Because some of us have worked with the application to start with, and I think this is more or less the same question.
More or less the same question, but I think we can recommend everybody that if they have the chance for some issues, not to talk to the focal point, the people or the person in the hospital, then that can update this information. I think this survey is a good opportunity, to contact that person in particular and check with them if this issue has changed over time. I think.
Yes, and I think it's a good way of self-assessment, as you say.
Of course, but I guess that most of these things, as they are in the organizational level, if we answer it in the beginning when the application form was made, probably in 2 years they haven't changed a lot. So
no, I think it will more or less be the same. That's true.
Yeah. So that's again very similar when we ask. I'm going through the list when we are talking about third-party or competent authorities inspections and assessment.
But I think it can differ to some extent when it comes to informed consent policies, because the GDPR has been.
Of course, that's very interesting. That's a very interesting topic. Yeah, that's I think a topic that if I mean the general, the European general.
It could maybe be added as a specific question if GDPR has been sort of applied at the healthcare provider level.
Yes, I agree. We can check we can check the survey and ask about the general directive, the European General Directive on Data Protection. That's a good point. Yeah, I agree. Some of these organizational changes we can imagine them because they are overall like this European regulation. I mean, the European law. Perfect. Well, just to finish, of course, I said it's a long list, but we would like to have also some information at organizational level about international and national certification, policies for national references and cross-border patients. I think we realize that in many European countries there are reference networks, national reference networks, and I think that this will be a good opportunity to check if this has changed from the original application form. And finally, another issue that concerns one of the working groups of the network is about policies and procedures for knowledge management. That we know that we still have a lot of work ahead, but we wanted to include it also in the survey. It's a lot of information, but we encourage everybody to participate in the survey and look it as a opportunity to.
I have two comments here. I have two comments. One is that one possibility, I don't know if this is a good idea, and it's not a big issue for me, but you could have one alternative on each question that is a sort of, you can check if no changes compared to the original application.
You asked for it, yeah. I put it on the last slide at questions, and of course, I think we can test it this first year with the information that all the healthcare providers will upload into the survey. But once we have the information in the survey, probably we should be able to just from one year to another, not to just check if something has changed, then we put extra information in every topic.
Yes.
So that was the idea, no?
And will there be obligatory questions? Do you need to fill in all sort of boxes to be able to continue through the survey? Is that the idea? So
we haven't. I think we haven't established those boxes as compulsory.
No.
We can probably, if through this pilot, if we see that some of the boxes cannot be answered or they are just in blank, then we should probably just leave them. They should not be compulsory. We should establish only those questions that can be filled by everybody, I think.
I think so too, because it's important to have people filling in and answering the issue rather than to have 100% coverage here.
Yeah, I agree. It's a process. I mean, if step by step we can just provide more information, then it's easier than just make it everything compulsory so nobody can finish the survey. I agree.
That's good. That's good.
Okay, so just to go through the next slide, as we said before, there's a second block of information, and this probably is a very specific information that we are pretty interested to get from the healthcare providers, because, as I said before, the last information we have is about transplantation activity in 2016. Well, I think 2015, but the application form was in 2016. So I think we are very much interested in collect the transplantation activity from all the healthcare providers in the network. And just as we said, probably 2016 and 2017, that will be, I think, the most, I mean, we don't need information from the previous years, but those would be very interesting to get that information from. And I just would like to point out that we detected in the original application forms that some healthcare providers, when they applied to join TransplantChild, they didn't put in the application form all the information regarding all types of transplantation programs they had in their centers. So I think this is also a very good opportunity for those hospitals, if they are participating in other transplantation programs, to put this information in. So we have them in the global overview of the network, as we already know. The pediatric transplantation is being focused from a transversal point of view. So that's, as I said, one item that we would like to point out.
That's good.
The third item that also I would like also to clarify something about that is that we also have discussed in our board meetings the importance of having information about the pediatric or transplantation activity in general in our countries. So we have currently the possibility to have this information from this survey, but I would like also to tell that we are at the same time contacting the national allocation of organizations. We contacted the Spanish National Allocation Organization, and through the Spanish National Allocation Organization, we are having some data from the other European countries.
Yes, so and I know we had a question to the Scandinavian transplantations also, so we have this issue assay as well from that way.
Yeah, so I think that's a very interesting way of approaching to this issue. No, we want to have an overall view about transplantation, pediatric transplantation in the country, and also about the information that every hospital participating in the network, they should, I mean, they must have some information about what is happening in their country. So we probably can have, the idea is to have a map of transplantation all around Europe. So this item will help us answer these questions. Just to continue with other items that we are collecting in the survey, I would like to add also that we want to have some information about the professionals participating in the team, the transplantation teams. We discussed in the first year about the quality standards of which professionals have to participate in the transplantation, so now it's a good point. So we would like the hospitals to ask the specialists, the services, about specific professionals in the hospitals. No? And I think this is also a very good opportunity to collect that information and compare it to the standards we prepare it in advance.
I think it's very important.
Yeah. Equipment, infrastructure, methods. That's also in the survey. We would like also to have the chance to collect information about the outcomes, not only the activity of the transplantation programs, but also about the outcomes. We have prepared, or we have thought about outcomes regarding patient mortality, or supervivience. I mean, that's the issue about getting outcomes instead of activity, no? And also about the graft, no? The graft survival, patient survival and graft survival. So in the survey, we would like the hospitals to put into the last available data about the outcomes of their transplantation programs.
Yes.
This is also a good chance about collecting activities regarding research, clinical practice guidelines and protocols, education and training activities. As we said, probably this is the best way of collecting this information instead of asking in different surveys this information for every working group. No? So the idea is that our working group can centralize the collection of this information. And finally, quality registries, follow-up registries. We want also to have some information how hospitals are managing these issues about pediatric transplantation, and also what activities are developed with the patient organizations, the general public, and the society. You know, there are also some items that we expect people to put into, so we can have some data about that. And as I said, we think that we can recommend people, we can give some recommendations so people can fill up the survey. For example, we think, as we said before, that the global issues, both in part 1 and in part 2, can be filled by the healthcare provider representative with punctual help or some help of the specific persons in the hospital. And of course, transplantation activities need the participation of the responsibles of every transplantation program, and the data related to professionals. We think that the only way of collecting them is that the services, the specialists can provide this data from themselves. I don't know if you have something extra about some recommendations.
This is recommendations, but I think that it's important to understand that it might differ in different hospitals. So in some hospitals, this might look different.
I understand. Yeah, that's a general idea. Of course, in this pilot period that we will get into the survey, we will check it with the participants. So that's only an idea.
Yeah.
And well, I just put it on a slide, the questions you sent me, so we can discuss about these issues. I think they are quite important for the survey. Probably,
I noticed for the first question, I noticed that there were still some remarks and comments.
That's right.
From the edition in the text, and maybe I don't know if they should be kept or taken out of the official version. I don't know.
I agree. We can just leave them now in the pilot survey, and maybe when we fill it, just make it simpler. I don't know. I don't have an opinion about that yet.
Okay.
And of course, you can just introduce the questions. Yeah.
Yes. The second question was that, I mean, this is supposed to function as well as a self-evaluation tool.
That's the idea. Yeah.
It should be performed once every year, approximately. But I think it will be necessary to remind the participants to do it, because they will not sort of remember this otherwise. I think we need to remind them and send out the link to the survey once every year.
Yeah, I agree. I agree that we have to find a way. I mean, currently, this is a web form that I think that will allow people to put information into, but I'm not pretty sure how we can get it back. But we will look for it, Dr.
Yes,
Webb.
I think so.
I'm not sure how to do it.
No, and I think from a sort of a survey point of view, it's also important that you can go into the survey and answer some of the questions and then save it and then go back later and finalize everything. So you need to be able to go in and out of the survey. Otherwise, to do everything at one time point might be difficult.
I think that's possible already. There is an option at the top of the survey where you can just keep it active and you can keep the results, I think. But we will have to check it out also.
And I have the third question here. That I was wondering about how to handle these results. I mean, should we give some feedback to the participants, or should we sort of just summarize them for ourselves and keep them in the safe, or should we sort of publish them on the web page, or what do you think will happen with these results?
I think we have to discuss it on the working group. I think that we have to give some feedback. I don't know in how much detail this feedback should be given, but we have to give some feedback for sure, at least about activity. I mean, you know that we have already worked on our activity standards, and also about some indicators regarding outcomes and other issues about organizational aspects in the healthcare provider. I think that at least we should be able to give feedback in those standards and indicators that we said will establish for all the network, at least in that information.
Yes, I think that's important because everybody also will be interested to see what are the results and what are the sort of numbers in other centers and other countries.
Of course.
I think that's interesting. And maybe you can also sort of summarize the results of the assay or the survey and sort of present it in a more general way that for example, 80% of all the participants had a sort of a functioning system for patient consent or something like that.
I agree.
You can compare your own center to the sort of the mean sort of in Europe or these sort of like that.
Okay, I agree. I just think that we need more input from other colleagues.
I agree, and that's something that we really need. I agree.
No, I think that we will have a very good chance in our board that it will take place in November to discuss, even if we are able to get some data from both our hospitals and another 2 or 3 hospitals of people belonging to the working group, we should be able to give some feedback there. If we don't, I mean, at least that will be a good objective, a good thing.
I have good hopes that maybe Dr. Baker and Dr. Kaczynski could give some feedback to this survey. I think so.
Perfect. Yeah, I agree. Okay, perfect. So I don't know. Do you have any other question about?
No, I think I looked at the survey briefly, and I think it looked very sort of nice and professional, and I think that it could easily be filled in. And but it's important that you remind them, all the participants, that they should go in and that they have this link, so it's easy for them to get into the survey.
Okay.
Otherwise, I think to start to look into old emails and look for the link and everything, that can be troublesome for some people, and I think it should be made very easy for them. That's the key point, I think, to get people to just fill it in.
Okay. Okay. Yes, we will do it. I think that from today's webinar, we will just give this message as just like the last slide. So I think this is the message to take back. I think that at the beginning we said it in the last board. I think it's important that every healthcare professional, every healthcare provider representative, they don't have to be alone. I think that they need to involve the people, of course, regarding transplantations program, not transplantation programs, but also other key people in the hospitals that can provide the organizational information that we are asking.
But I guess that what we want is one survey sort of from each healthcare provider.
That's the idea,
we don't need many sort of, because in some centers, for example, there is one service doing the kidneys and one service doing the heart and another service doing the livers.
No, the idea is
we need somebody to sort of put all this data together in this survey.
Yeah, and and the recommendation for other hospitals participating in the network, if they don't have that information, they can ask for. I mean, for example, in our hospital we have arranged local groups for the network. So I think that you can ask Hospital La Paz or other hospitals on how they are handling the participation of hospitals in ERNs, in European Reference Networks, because it doesn't have to be one person initiative. That's
of course not. Of course not.
It's impossible to fill this survey if you are one person.
No, that's impossible. That's impossible. I remember how it was when we did the application, that you needed sort of a lot of people to help you. But what I just wanted to make clear is that if I understand you correct, you want one sort of survey filled in per healthcare provider, not several.
No, one survey per healthcare provider. That's the idea.
Good.
That's the idea. Because we need, I mean, of course, the information will come from different people inside the hospital. But we want that the representative of the healthcare provider can put in all the information together in the survey.
Yes.
As we said, if we want to move ahead, we need to pilot the survey, and of course, all the feedback that you can send us both to us in the Hospital La Paz or to Dr. Wember in Karolinska Hospital. It will be very much welcome. And if we want to move on the quality improvement, we need that information. If we are not able to gather information, we won't be able to know if we are far or near our standards. So that's, I think, an important milestone. The survey.
I think so. I think
in the network.
It's a key factor for success with the ERN TransplantChild, I think, and we are sort of, I strongly support that we try to get the input from our working group members.
Yeah, we will focus on that too, because we need that input. I agree. We talked about that before, and we will push forward on that. Well, I think that was all. I don't know if you want to add anything else, Dr. Wember.
Oh, I would just like to thank you, Jose, for arranging this webinar. Very nice.
Thanks to you, and we hope that all the healthcare providers that are able to watch this webinar can have an idea about what we are developing in the Quality and Safety Working Group, and we encourage them to fill up the survey. So thank you very much to you, Dr. Werber, and to everybody. Okay?
Thank you. Thank you very much. Goodbye.
Thank you. Bye-bye.